My name is Joseph Irizarry. I'm going to be going through a knee evaluation video. I have my partner here, Luis Alvarez, and we're going to demonstrate kind of the process that goes into that. So, why don't you tell me what brings you in today? Go.
All right, so I run cross country. Kind of hard to believe, but for the past couple of weeks, I've been feeling some kind of like pain on my knee.
Okay.
Yeah, so and it's it hurts like as I warm up, like start doing a little warm up, and it doesn't really hurt so much. It kind of hurts when I like run, but it also hurts after.
Okay. And so you said this has been bothering you for approximately a couple of weeks now.
Yes.
And how far into the season are you guys?
We're about in the beginning.
So have had a couple of weeks into the season so far?
Yeah.
So did it start bothering you right when the season began, or was this like last week when you really noticed it? Do you kind of know a time when it really bothered you?
Okay. Well, it was a little bit after the season began when we started upping our mileage. That's when it started getting like a little bit more. That's when it started to hurt. And so, like I said, about a couple weeks ago, it started hurting the most. Okay. And it just hurts after when I run, when I warm up, and stuff like that.
Okay. And so, what event do you do in track?
I do long distance.
Okay. And between your practices leading up to the season and now, like when the season began, I know you said you guys had an increase in how much you guys ran or what you did in practice or in events. How many events have you had in the past couple of weeks?
In the past, we've had 2 track meets, kind of almost back to back, or like a week apart. So I did a couple runs through there.
Okay, and so did you have a couple of events in each meet, or was it just kind of like, did you have just one event that you participated in?
It was a couple of events.
A couple of events in each? Okay, and have you had any like issues with knee pain before at all?
No, I never had.
Okay, and so where specifically, if you take your finger and point to a spot that's bothering you the most?
It hurts like here in the bottom, like in this area.
And do you feel like when I know you said it bothers you when you warm up, but also after you're done participating, it kind of lingers and bothers you for a little bit. How would you describe the pain? Would you say it's like sharp shooting pain, or would you say it's like more of a dull, achy pain?
It's a dull, achy pain. Okay. It's kind of like, not like a sharp pain, but it kind of like, it's a discomfort that's like, I just wanted to, get it out the way.
Okay. And when I know it's been lingering for a while, but do you remember any specific, whether it be an event, whether it be a practice, any specific moment where you felt like it really started to bother you the most?
No, it was just like one day I practiced, I was just like warming up, and like I felt some pain, but I mean I didn't think anything of it, so I just kept on running for the couple weeks, and then it just started to bother me little by little.
And when you really started to kind of notice it, did you feel any popping, any clicking, anything like that?
No, just the aching pain.
Just the aching pain?
Yeah.
And any numbness, burning, tingling sensations?
No, nothing like that.
Just straight up kind of dull, aching pain?
Yeah.
And when you run, when you warm up, afterwards, do you feel that pain stays in the same spot, or does it go up your leg or down your leg?
It kind of stays there.
Stays there?
Yeah. Well, like there's once in a while it kind of goes up, down, but it just stays mostly in that area.
Okay, and if you had to describe it, if you had to rate pain on a scale of 1 to 10, 1 being very minimal to no pain, 10 being you're taking your VER, 5 being kind of alters how you move, how you run, how you do things, what would you rate your pain?
I would say about 4 or 5. I mean, it doesn't hurt to the point where I have to go to like hospital. It's just annoying to deal with.
Okay.
It's just an aching pain.
So you say it's like, you describe it like as a nagging?
Yeah.
Okay.
It's annoying.
And how long have you had the running shoes there?
Oh, they were kind of brand new. I only ran like a little bit before to break them in, but they're just pretty much brand new.
Okay, and do you use any orthotics in your shoes?
No.
No? Have you ever had any like ankle or arch pain, anything like plantar fasciitis or anything like that lingering in your feet?
No, I mean I had some foot problems since like when I was a kid from like running. I used to run as a kid. Other than that, I mean nothing really major.
Well, when you say foot problems, what do you mean?
I mean, it would just kind of hurt like in the ball of my foot.
Okay.
When I like kind of started new to running, but other than that, I just dealt with it and hasn't like came back since.
ever experiencing any shin splints or anything else like that?
Shin splints, yeah.
Shin splints, and have you ever like taped those, iced those, anything?
Just like ice, pretty much. It wasn't really, you know, they happen to everybody. To me, it was just ice, and after a while, it was gone.
Okay, and what about for your knee specifically? Have you iced it the following weeks? Have you taken any ibuprofen for it at all?
I mean, a couple times I would ice it, and it would feel better, but then it would just keep on coming. And it's just like annoying.
Okay, so just kind of dull it for a little bit, just kind of mask it, but wouldn't help you.
Yeah, exactly.
Okay. And so you say that your pain is localized to like right around there.
Yeah, in here, it's like this little soft spot. You kind of feel right in there, and just when it starts to like really hurt.
Okay, well, after going through a history with them and getting some questions, kind of getting a better idea as to what's going on, I wanted to look at the possibility of the shoes, arch support playing a role. The idea, and the reason I ask those questions is if you have any problems with your shoes, any issues with the feet, if you have high arches, low arches, any pain like that, it can alter your running mechanics, which then will put added stress on your knees. So that's why I kind of wanted to talk about that with you. But talking about how it's a chronic injury for him, it's kind of nagging, and it's been lingering over the past couple of weeks, and it stays localized to the area throughout his activities. The first things that come to mind is patellar tendonitis, but also we could have possibly a stress fracture present. You have your quadriceps tendon that comes down and cases the patella, and also kind of comes down past that, and that's the patellar tendon, and it locates onto the tibial tuberosity right here. And there could be possibly a case, maybe a stress fracture, which is causing the pain, which would be something that would also kind of be a progressive issue, take some time to develop, so that could be present as well. So I'm just going to kind of go through some things with them. So I'm going to do an inspection real quick to kind of get more than what I see right here, kind of get a better view comparatively to his other side. And then I'll go into some palpations, go through a few tests, range of motion things, and we'll kind of see where that takes us, all right?
Okay.
All right, so now I'm just going to have him just kind of sit as he is, just kind of relax. I'm going to look at his needs comparatively, and some of the things that I'm kind of looking at is for discoloration, redness, looking at the patellas themselves to see if their alignment comparatively, see if there's any issues with alignment. Also to see if there's any other deformities that may be present, any swelling, anything that could be out of place, because it's something that could be possible with him. Well, not necessarily with him, because he hasn't had any issues in the past, but one of the things you could look for is that tibial tuberosity that I mentioned that could be tender for him. Sometimes they could have a lump there that may not be too visible, and that could be from conditions as a child, like Osgood Schlatter's and stuff like that, which could cause some issues there as well. But everything seems to be relatively level. There's no real discoloration there. Would you mind go ahead and standing up real quick for me and just do kind of a half squat?
It hurts right there as I like come down.
Mm-hmm. Go back up for me. And then just do it and just kind of slowly do it for me one more time.
It hurts right there.
Okay, you go back up and relax and take a seat. So kind of what I want to do there is, one thing I want to look at is patellar tracking. I want to look at both how his patellas move when he goes through the squatting motion. One of the things is, with the muscles I talked about, the quadriceps come down and they make the quadriceps tendon that goes with the patella into the patella tendon. If he has tightness in his quad muscles, there could be some tracking issues, which is causing some issues there, but he doesn't have any tracking issues when I go through the squat. Do you have any stairs at home, or do you have any like upstairs classes on the campus, anything like that?
Yeah, when I would walk upstairs, it would kind of hurt. It was like I pressed down as I would go up. It would just hurt in that area.
And when you go upstairs and you go through those things and it causes you some pain, did you notice any clicking or popping when you did those?
No.
Okay. And so I just ask questions like that because you could look at maybe some meniscus damage, which could cause some of that popping, clicking sensation in the knees. Just want to make sure that he has no issues with that. All right, so going through that, I'm going to go through some palpations real quick. And for the sake of time in the video, we're going to say that I palpated the uninvolved side, and we'll go through the involved side. And so with palpations, just want them to relax. So I'm just going to do, kind of feel around, see what's going on. Is that okay?
Sure.
All right, so I'm going to start with the patella as my first landmark. Any pain or discomfort?
No.
And I'm also feeling to see any false movement. Like I said, one of the things I'm looking for, either on the patella or on the tibia, is a possible stress fracture. So I want to make sure for any false movement with that. Go up to the quadriceps tendon and the quads themselves. Any pain with that at all?
No.
No? Okay. kind of go to the lateral and medial aspects of the knee. Feel the bony landmarks. Any issues, any pain with those?
No.
All right. And how about as I work my way down here?
It feels, that's where it hurts.
That's where it hurts. Okay. And when I press there, does the pain radiate anywhere when I press on it?
I mean, it doesn't when you press on it, but that's just where the area.
Okay.
That's where it hurts.
Any tenderness as I work down?
No.
Okay. Anything down here at all?
No.
All right. So the pain is very much localized to that area, and that's where he's having all his pain. No pain muscular-wise. So that seems to be good, but that is pretty much consistent still with like patellar tendonitis, which is what my primary diagnosis is. I'm going to do some quick compression. Any pain with that?
No.
Go ahead and relax. Any pain with that? How about any pain here?
No.
All right, just to kind of brush up and make sure that there's no potential fractures, upper, lower femur, tibia, fibula. Kind of go through those. I'm leaning more away from a potential stress fracture, leaning more towards patellar tendonitis. Just go through some motions with you real quick. First of all, I'm going to have you do them by themselves. So basically, just what you're going to do, real simple, is you're just going to take your knee and extend out for me as far as you can go. Pain, discomfort with that.
There's when I do force it forward.
We do like
So,
a forceful contraction.
Yeah, here's fine until right here, and it hurts in this area.
So the pain stays in the same spot.
Yeah.
Pain scale of 1 to 10 when you do that.
When I do it, I mean, it's not like, I would say 5. It's just annoying.
Just
that it's
annoying.
there, yeah.
Okay. So now I'm just going to have you relax. We're going to do that movement, but I want you to give me a dead leg. I'm going to do the movement for you.
Okay.
Pain, discomfort at all with that? No. Not really. Okay. We're going to do the same thing, but I want you to go about, we're going to go about halfway, and I'm going to provide some resistance going down, and I want you to contract and try to keep your knee extended out, all right?
Okay.
So go ahead and go. Pain, discomfort with that?
It hurts.
It hurts?
That's when it starts to hurt.
Same spot?
Yeah.
Same, like, would you say it's a 5 as well, or worse?
5.
5? Okay. Go ahead and just take your knee, bring it up like that. Pain, discomfort when you do that?
No.
All right? Go ahead and just lift it up, but hold into that position, don't let it push you down. Pain, discomfort with that? Okay. And for the sake of time in the video, we're going to say that I compared it bilaterally and to get a baseline for him. So some of those movements, looking at the quads, looking at how the extension of the knee, that's what causes him the most pain, puts tension on the patellar tendon right there. Once again, consistent with a patellar tendonitis issue. The big thing now is we could go through some imaging, just to make sure that there is no stress fractures there, because those could be present, and those types of tests can sometimes not be really truly indicative if you have a stress fracture or not. And so x-rays are pretty simple and don't take that much time. So just to be a little bit cautious, I'll take order an x-ray and have that rule out any potential stress fracture that's going on there.
Okay.
Because especially with long distance runners, if you're having issues with your shoes because they're relatively new, or you're having extended practice sessions, or you're running longer, that added force, if you're not maybe ready for it, you could have some issues there as well. But I really think it could be patellar tendonitis, but the plan from here is we'll get that x-ray, rule that out, and if it's consistent with patellar tendonitis, which is what I think it is, what we'll do right now is we'll put some ice on it. We might even put you in a game ready, so that way we can control any issues with swelling, inflammation, as well as give you that ice component to help you with the pain. So we'll do that. And after we get those test results back, and if it's negative for a stress fracture, what the plan's going to be is we're going to work on hamstring strength as well, just so that way we can make sure that we don't make you too quad dominant to create any imbalance there, that would create even more unnecessary force on the knee. So we're going to work on strengthening the hamstrings, as well as making sure you don't lose any range of motion in your quad, in your hip and knee, and by keeping your quad strength up as well, because you need that for your events. So we're going to do some ice, get that image done, go from there, work on strength, range of motion, build those up, and make sure that we keep that flexibility so that we take down the stresses that you put on your knee.
Okay.
So it'll be a couple of weeks, but you should be you should be all right. So, thank you very much for your time. I'm Joseph Irizarry, and that's my knee evaluation video.